Hello friends, today we are going to discuss HIV. So without any wasting time, let's start. In this video, you will learn etiology, pathophysiology, clinical features, staging, diagnosis, management and complications of the HIV. So yeah guys, now the etiology of the HIV. So on the image you can see the the the, the picture of the virus. So there is a deployed two RNA molecules present in the nucleus of the HIV, and there is genome which code for this proteins. So we have Pol gene, Gag gene, and the NF gene. Okay, so we have three genes which code for various proteins. So Pol gene codes for the polyprotein, which consists of a protease, reverse transcriptase, and the integrase. Okay, so these are very important. So polygene, it it is synthesizes proteases, reverse transcriptase, and the integrase. Okay, then gag gene for the matrix protein P17 protein, new nucleocapsid, and the capsid protein P24. Okay, so this protein is also very important. P24 protein. Okay, and the N gene code for the GP160. Okay, uh, which can be cleaved into the envelope glycoproteins like GP1T, GP120. It enters it attaches to host CD4 plus T cells, and GP41 assists the infusion and entry of the virus into the host cell. Okay, so we have three genes: Pol gene, Gag gene, and the N gene. Pol gene, it uh, it encodes for the proteases, reverse transcriptase, and the integrase. Okay, Gag gene, it, it, it encodes for the P17 and the P24. Okay, and the N gene, it codes for the GB120 and the GB41. Okay, so these proteins are very important, and you should know about this. Okay, so in order to remember this Paul Jean, I have a beautiful mnemonic for you. Polly is a really important person where the proteins coded for the Paul gene are reverse transcriptase, integrase, and the proteins. Okay. Okay. So the pathophysiology. So this virus first of all attacks the macrophages via the CCR5 receptors and T cells via the CXCR5 receptors. Okay, so this virus when it first of all attaches itself via the GP120 proteins. Okay, then there is some conformation change in the cells, and this conformation change is brought about by the GB41. Okay, and then there is a penetration of the virus. Okay, and there is uncoating of the virus. Uncoating means like the the capsid which is which has been entering into the cell. It gets it gets broken down, and the genetic material is released into the cytoplasm of the host cell. Okay, now this virus now this viral particles, which are the RNA particles, they uh, they uh, they undergo a process called as a reverse transcription. Okay, um this so you know the transcription means making of a RNA mRNA from the DNA. Okay, so reverse transcription means making of DNA from a double stranded RNA. Okay, so in this in this process the reverse transcriptase enzymes are required. Okay, and yeah, so then the DNA is formed. Okay, DNA enters the nucleus via the nuclear pores, and then uh, it undergoes integration via the enzyme called integrase. We have discussed Polygyn. Polygyn has a protease integrase and the reverse transcriptase. Okay, so then yeah. So then this integration, after the integration, okay, the viral DNA uh, uses is used as a template to form the more viral DNA. Okay, and then the transcription of the DNA occurs. So after the transition, the RNAs are formed. Okay, and the proteins which are which are basically viral particles. They are they are released into the cerebellum. Okay, and then the transition of the protein occur. Okay, and then the new viral particles are synthesized. Okay, and then they're released. Okay, so this is the all the pathophysiology of the HIV. So here are drugs which are required to break this cycle. So we have NTRTI, that is a nucleotide reverse transcriptase inhibitors, like tenofovir, idofovir. Okay, also NRTI, that is a nucleoside reverse transcriptase inhibitor, like did, did I know did, did I know sin bucket? Did- These names are very weird. No, I have some pronunciation difficulties, so bear with me. Okay. So the features of the HIV are like this: HIV can remain in the body for a very long time without causing any symptoms. So this is called as the window period, and it is more like like 10 years. Okay. For up to 10 years, it can remain in the body without causing any symptoms. And and now let's talk about the acute HIV infection. So this is also referred to as acute retroviral syndrome, which mimics the infectious mononucleosis syndrome features, like fatigue, uh, then malaise, headache, generalized non-genital lymphadenopathy, and it's like GI symptoms like nausea, diarrhea, and weight loss, and oropharyngeal symptoms like sore throat, ulceration, painful swelling. As I have told you, the latency in the AIDS is very long. It can stay in the body for up to 10 years without causing any symptoms. Okay, and yeah, so non-AIDS defining conditions like CD4 count is below 500 cells per cubic mm. Um, Coronary diarrhea for more than 1 month, and the localized opportunity infections, oral candidiasis, oral hairy leukoplasias, HPV-related squamous cell carcinoma, and skin manifestations like molluscum contagiosum, warts, exacerbations of psoriasis or shingles are very common in these patients. You can see the diagram of shingles, oral candidiasis, and the oral hairy leukoplasia. Yeah. Okay. So now WHO criteria for the staging of the HIV. So we have 4 stages. In stage 1, the patient is often asymptomatic. In stage 2, the moderate unexpected weight loss, and also like funnel nail infection can be seen. And in stage 3, weight loss is there with pulmonary tuberculosis, and stage 4, HIV vaccine syndrome, and all the opportunity infections can be seen, and also the Kaposi sarcoma can be also seen. Okay. Now the diagnosis of the HIV can be made via the measuring the HIV antibodies and the antigens in the plasma of the patient. So antibodies measured are the IgG and IgM, and the antigens present in the plasma are P24 antigen. Okay, and the WHO recommendation for HIV testing is if the patient is less than 18 months, then HIV DNA or RNA PCR or HIV culture, and if the patient age is more than 18 years, then IgG antibody to HIV by ELISA and the Western blot test. Okay. So guys, how will you manage the patient of the HIV? So all individuals with HIV infection, regardless of the CD4 count, should begin antiretroviral therapy as soon as possible. Okay, and the antiretroviral drugs are combined to prevent resistance. Okay, all antiretroviral drugs are able to target both HIV and HIV1 and HIV2, except for the N-4-virited and the non-nucleoside reverse transcriptase inhibitors. Okay, if the CD4 count is less than 200, start prophylaxis for the opportunistic infections. So in order to learn the drugs, I have a very short mnemonic for you guys. Protease inhibitors end in navir, integrase inhibitors end in gravir, and the nucleoside reverse transcriptase inhibitors end in woodin. Okay, so nucleoside reverse transcriptase inhibitors are the tenofovir and the uh, adafovir. Okay, nucleotide reverse transcriptase inhibitors are the tenofovir and the adafovir. Okay. Then we have the protease inhibitor which end in the navir. So we have the atazavir, uh, daruna, darunavir, and the fo, fosamprenavir. Okay. ठीक है. And the integrase inhibitors like gravir, uh, dolutegravir, uh, elbitagravir, and the raltegravir. Okay, and the nucleoside reverse transcriptase inhibitors are like abacavir, uh, zidovudin, l- lamivudin, and the m m imidazoline. Okay, so these drugs are very fucking confusing. So you should learn this. Okay. Okay. So now, lastly, the complications. So the complications are various. They are dangerous, and one of them is the immune reconstitution inflammatory syndrome. Okay, and the definition is like um, and inflammatory syndrome that can occur after initiation of a PRT and consists of either the appearance of new condition or worsening of a pre-existing condition. Okay, and the causes believed to result from the restoration of immune system and its response to the antigenic stimulation, and this stimulus may be infectious even myco- my, my, mycobacteria, HSV, CMV, or the cryptococcus. Okay, guys, that's it for today. Thank you for watching, and as always, keep learning. Uh, Bye. Subscribe to my channel. Okay.